Standard work for whiteboards in surgery and procedural areas. The trigger is known surgical cases or procedures. The count is performed by the RN in charge of the case or the procedure. Step 1. All whiteboards will contain an area for patient name, procedure, and allergies. If the patient has multiple allergies that cannot be written on the whiteboard, write multiple and see EPIC. Latex and adhesive allergies should always be written on the board. Step 2. For all areas where procedures are performed that involve items such as sharps or sponges or any other items that should be counted according to policy 854, the order of information to be placed on your whiteboard is laps, Raytech, needles, blades, bovie tips, and injectables. All these items should be placed on the whiteboard as a permanent line item. The order should be consistent on all whiteboards in all rooms. Be sure that your board allows room for commonly added items to surgical fields, i.e. needles and sponges. Step 3. A paper instrument count sheet will remain and should be maintained for each facility and used when counting instruments. Initial count is completed. Please attach to the whiteboard. Step 4. There are several items that are considered movable items that are to be placed as magnets at the bottom of the whiteboard. These items included but are not limited to scratch pads, Fred, clip bars, caps, vessel loops, umbilical tapes, Webster cannulas, peanuts, red rubber catheters, bulldogs, Fogarty inserts, clamp covers, tie knots, thoracic trocar pieces, neuropatties, wax spears, and Penrose drains. Step 5. When an item is packed into any portion of the body, peritoneum, vagina, rectum, etc., the person packing the item should verbally notify the operative team. The team should confirm that it was heard. If it's not verbalized by the surgeon, anyone who does observe this action should announce to the team how many of what kind of item was placed where, so the item or items must be placed on the whiteboard count. Step 6. Never erase counted items until the procedure is complete and all items are accounted for. The proper method is to strike out. When erasing your writing, if you're writing something wrong, it is acceptable. However, continuous counts should be maintained and not erased so as to keep a running count of items and to make it easier to resolve a potential discrepancy. For example, if you were to have a contamination or an item drop off your field,
we're starting with 2 bovie tips. 1 bovie tip has dropped off the table. So we're going to account for that. Minus 1 bovie tip leaves us with 1 bovie tip left on the field. Now we have to open another bovie tip. So we're going to be adding 1. So now we are back to 2 bovie tips. The one that was dropped is now in the contaminated items.
The circulator should erase the patient information from the board when the case is complete and all of the accounting has been completed. This is to help maintain HIPAA and to prevent errors.